Allergic rhinitis is not a disease per se. It's a disorder. You are born with this disorder. It's a problem that is in your genes. It's actually a tendency of your body to react unnaturally to those substances which you should not, such as some feather going in your nose, you will sneeze, it's fine. But for normal air, or for some normal air, some moist air, some cold air going into your nose, which actually should give you a pleasure in a going to some place, you should experience a pleasure that some I can smell some cold air, I can feel the cold air. Instead of that, it has started giving you a response in form of sneezing, in form of cold, in form of itching in the eyes, and leading to a hysterical condition like where you sneeze a lot, where you cough a lot, where you have breathing difficulty and nasal blockage. This disorder is called allergic rhinitis. For this, we have to divide allergic rhinitis into two parts. It can be seasonal or it can be perennial. Now, what do you mean by seasonal? People who have allergic rhinitis and only in season, in a particular season, like somebody who is having coughing or sneezing only in rainy season, or only in winter season, and rest of the time he or she is okay, then that is called seasonal allergic rhinitis. And one person who is having these kind of allergic symptoms all year round, regardless of the weather is there, he or she is all the time allergic. That is called perennial allergic rhinitis. Now, what are the causes? I told you it's a genetic problem. It's a problem in a disorder if somebody is born with it. Now, what can cause allergy? Now, that depends. The commonest allergens are pollens. Pollens, you know what pollens? The small, the flower particles that come out for breeding of the flowers. Normally, it is present in seasonal. If somebody is allergic in seasonal, they are the most common things which is responsible for it. It can the plant can be growing 200 or 300 kilometers away, but by wind it can come to your place where you're living, and you can catch a hold of it, and you can catch allergic rhinitis later on after that. Second most common cause is danders. Now, what is danders? You might be having pet dogs or cats. Those here are very common cause of allergy. Then we have house dust mites, is very, very important. These house dust mites also secrete some hormones. They also release their excreta here and there, and they also become dead. And there are chances that you might become allergic to these things also. So if you are allergic to these kind of things, you can certainly have perennial allergic rhinitis, because house dust mites are present everywhere, and you can have allergy all year long because of them. The first and foremost symptoms of allergic rhinitis is sneezing. People tend to sneeze a lot, start sneezing. Second symptom is watery nasal discharge. Third, the nose becomes blocked. The nose gets choked, which a person is not able to breathe well. Because of these repeated episodes, your head might become heavy, your face might become heavy. You have to have itching in the nose, itching in the eyes, watering from the eyes. The water will start dripping from the eyes. Itching also occurs in your ears, sometimes in your behind the nose, in your throat. And along with that, you can have throat irritation. And if the symptoms worsens, you can have cough also, leading to a secondary part of the allergic rhinitis in form of bronchial asthma and bronchitis also. Allergic rhinitis is very clear from its symptoms. The patient tends to have sneezing, nasal discharge, itching in the nose, itching in the eyes, sometimes ears and throat also, and it's very clear from the history itself. But yes, on examination, if you examine the nose might appear a little swollen, little boggy. There might be dark circles below the eyes. There might be shining on the nose. Then if you see the inside of the nose might appear a little blue. The secretions are very watery, very clear and watery, not thick or yellowish. They're clear, watery kind of fluid coming from the nose. The eyes might be having some red dots also. The throat might appear red. And sometimes in aggravated conditions, a patient might be having polyps also. The mucosa grows into an extent that that they are polyp formation in the nose, and this actually further aggravates the symptoms of allergic rhinitis, because the polyps themselves keep on releasing secretions, and these secretions further then enhance the allergic rhinitis symptoms. So it becomes a vicious cycle, and the disease tends to progress at a faster speed. The best way to avoid allergic rhinitis is to avoid the exposure of allergen you are allergic to. You got the point what I'm saying. The thing which you are allergic to, if you are not exposed to it, you will not get allergic rhinitis. Now, how can you do that? If you are allergic in a particular season, if you know that, yes, I am allergic to this pollen or that pollen, if it is growing somewhere nearby in your garden, I cannot talk about other people's garden, but it is in go, better replace it. Better take it away and keep it somewhere else. Avoid going in dusty places, avoid going in dirty places, avoid going in places which are too soily. Soil particle is very small and it's flying in the wind. Avoid going to those places. Keep your home clean, and preferably keep that furniture which does not attract dust. Then yes, you can be allergic to a particular food also. So if you come to know of the food you are allergic to, start avoiding it. Do not try to test yourself. If you have found that yes, I'm allergic, you are going to be allergic for the lifetime for it. So do not test it regularly or repeatedly. Avoid putting fumes. Avoid going to the kitchen. If you have to cook, put a good chimney, or ask someone else to do the cooking, or ask someone else to do the cooking. And when there is time of fumes coming out, you better get out of the kitchen. Keep your nose clean. That's very important. You can wash the nose. You can keep the nose clean. You can wash your hands also all the time.